Hi everyone, Sue here again, and welcome to week 3 of the course where we're going to focus on critical thinking. And the exciting part of that for me is I know all of you are just old hands at this. And so hopefully what we're going to do is take what you know, what you do every day, make that more visible to you. So hooray, you can really celebrate, but also make it a little bit more transparent and push you forward with some of your critical thinking. This, I'm not going to talk about the critical thinking per se and provide you with all the information. This is an overview of what's going to happen in week 3, and I'll talk to you about that in just one second. So here's what we've got. You're working in your small groups, and congratulations, all of the groups have posted their first synthesis post into the large group forum for all of you to be able to read. Substantive posts from all of you for at least 2 of the large groups, and that means that you don't just say, yes, I agree, or great post, but you're actually going to reflect on what that group has posted, provide additional literature or commentary that really moves everyone's thinking forward. You're polite, you're supportive, but also you can have different kinds of ideas. So that's your work for this week, and we move into the next synthesis posting directions that will open next Monday at noon. For the theory component this week, you're going to look at this new topic that we're starting, critical thinking, and there are some readings and some lectures posted. So first of all, there is a short, maybe 25-minute PowerPoint Zoom lecture that I've recorded for you, and it really focuses on this thing called thinking biases. And thinking biases are sort of traps that we fall into, where our thinking, without our even knowing it, in a subconscious way, is skewed, and that can inform our decisions in such a way that we may make wrong choices, or we may not open ourselves up to other possibilities. So it's really interesting in the context of critical thinking that we really explore this idea of what biases are affecting our thinking. And I go through some of the most common biases, and at the end of that presentation, you'll see a link. I really, really hope that all of you will follow that link. So I'm going to post that link separately. It's in the, you'll see it in the PowerPoint slides at the last slide, but it won't be on my Zoom lecture. And that is a link to the story of Blackman, a remarkable 15-year-old boy who had a catastrophic hospital experience leading to a catastrophic outcome. And what we get to see as we hear that whole story is are the thinking biases. So listen to the lecture first and then watch that story and try to identify where you see those thinking biases. Then there's an updated nursing process link. This is an interesting one, I think, for all of us. So we all know the nursing process. All of you learned it. You don't focus heavily on it in the university programs, although you will see it in the NCLEX, and certainly that process, some kind of process for critical thinking is essential. And so let me go over the steps here, and you'll see it in that video. It is important to watch. It's a great video. It's quick and right to the point. Assessment, we all know everything starts with assessment, a good, strong assessment. Diagnosis refers to nursing diagnosis. You see that very rarely in Canada. It's very common in the United States, and that's a nursing diagnosis, the NANDA diagnosis. Some of you may have experienced that in your PN programs. You may have learned about nursing diagnosis. I would find it hard to believe that any of you actually see that in nursing practice. In Canada, I have not seen it at all. In the United States, it continues to be prevalent in some centers. And in many American textbooks, medical, surgical, other kinds of textbooks like that, you'll see nursing diagnosis represented. And that's why I put in brackets, because we really don't focus on it here. It's a defined terminology. We don't use it. You won't see nursing diagnosis on the NCLEX in Canada because we don't use it. And here's the new one, outcome identification. So right from assessment, before we get to planning, remember we went assessment, planning. Oh no. Assessment, and then I identify what are the anticipated outcomes, what are the expected outcomes that I would see in this situation, the outcomes that I would be looking for. So outcome identification is that new step, and we identify those outcomes early rather than just waiting to see what unfolds at the very end in our evaluation, because by identifying the outcomes, I can continuously make sure that I am on track to meeting those. So after outcome identification comes planning. So we want to plan. Plan for create that plan of care. We want to implement that plan of care, and then we want to evaluate it, and we're going to evaluate it in terms of the outcomes that we had identified. So have we met those outcomes? Fascinating, right? I hope you enjoy that. And then there's a couple of readings that are posted. One is Critical Thinking and Clinical Reasoning chapter. It's a very easy to read, well written chapter that really focuses on the basics. I know you'll know this. There's also a wonderful article that focuses on the development of critical thinking as an essential skill in nursing students, and really does a good job of helping to define how to promote those skills. For this week, as we're looking at critical thinking, very intentionally, we're not opening a PowerPoint lecture with those two readings at the beginning of the week. It's important to make sure that as you're doing that reading, and you know what, hint, hint, I know you all know how to do this, but let's just pull ourselves to the starting line together, make sure we're all there, that you be able to look at all of your readings and all of your courses and pull out those most salient points. What mattered the most? What was relevant about this reading? Sometimes your professor has a particular bent on something. And so if it's new content, then it might be different than you had expected. But in this case, we know critical thinking. All of you are working in different kinds of practice settings. So we really wanted you to take this, look at those two readings and try to make notes that really highlight what are the key points. You don't have to write everything down, but for you, as you read those two readings, what are the key points? Through this course and other courses, you are responsible for your readings, regardless of whether the professor has specifically talked about them, created a PowerPoint, done a lecture, however that may go. So it's important that you be able to pull out those points. I know you can do it. I have the greatest confidence in you and the utmost respect. But for this week, we're asking that you do that just as an opportunity for you as well to see how that process unfolds. So there's those two readings, Critical Thinking and Clinical Reasoning, that chapter, and the development of an essential skill for nursing students, critical thinking, that development of that skill. Both of those are posted in this week's materials. We're going to ask that you take that time, where you find that time, to make notes for yourself in whatever way you like to make those notes. And then you'll compare that to how we do an overview at the end of the week. That'll be posted at the end of the week. I hope you have a fantastic week. I am looking forward to carrying on. Leslie and I are just can hardly wait to read all of your synthesis post number 1. And again, a reminder, please reach out if there's anything we can do. If we can be helpful in any way, please don't hesitate to reach out. Thanks so much and have a fantastic